again, my name is Dr. Sandra Gomes. I'm a physical therapist here at ProClinix. If you attended our first web series, then you are well aware of where we are and what we do. But for those of you who haven't, I am a physical therapist here on staff, talking to you a little bit today about lumbar spine pain and some of the exercises we can do for strengthening. And the reason we're talking about that today is because in our first web series, we talked about a few stretches that can open us up and help that low back pain. So why don't we get started with some of our exercises. And before we do that, for those of you who saw the first mini web series, you're well aware of why we're doing some of these strengthening exercises. But for those of you who weren't able to attend the first go around, we're going to talk a little bit about why we do those today. So for low back pain, as mentioned previously, what happens is sometimes people start to curve their spine like so as a compensation. And again, there's a lot of tightness going on in here, a lot of tightness going on down here, and a lot of tightness up here. And what happens with this tightness is we get some sort of a muscle imbalance, sometimes called a lower cross syndrome, and we end up developing weakness in our core area and weakness in our glutes. So what we want to do today is talk a little bit about how we can strengthen that core area and our glutes so we can essentially stabilize that lower spine and alleviate some of our pain. Okay, let's get started with some of our strengthening exercises. We're going to hop on the table and start working for our posterior pelvic tilts. For those of you who participated last time in the web series, you'll know that we talked a little bit about that anterior pelvic tilt, which is that forward arch. A posterior pelvic tilt is essentially coming out of that. So we're going to round a little bit at the spine and open up those disc spaces so we give a little less compression in the area. So we'll hop on a flat surface, particularly a yoga mat at home. I'm going to be using the physical therapy plinth today. So we'll be hopping on top of the table. And again, you're going to be hitting those 2 points of contact and rounding at that lower back. So let me take away my hands for a quick second. We start here, and we round at that low back. You should essentially feel that lower core churning on. It's a very slight, subtle activation. And what we're going to do is hold this activation for 5 seconds. We will do this for 20 times, holding for 5 seconds each time. And this essentially gets a nice lower abdominal activation, namely your transversus abdominis, if anyone is interested in looking into the muscle. So this is one exercise we can do. Since we're already here, I'm going to use this exercise to follow into another strengthening exercise, particularly for the gluteus maximus. So essentially, with the gluteus maximus exercise, I want you to maintain that pelvic tilt. And we can follow up that pelvic tilt with an exercise called a bridge. So that means to lift off the table and get a nice squeeze of the buttock area. So we do this for 2 sets of 10, achieving a total of 20 repetitions. And every time we make sure to keep that pelvic tilt as we lift off and squeeze. And we do this in order to maintain that opening of that low back, because a lot of times people will compensate by going into that anterior pelvic tilt while they lift off. And unfortunately, when you do that, you're not getting a good enough activation of the glute muscle, so you're defeating the purpose of the exercise. And additionally, you're not getting, you might be causing a little bit more pain than you intended to when you're doing this exercise. So another thing to point out with this exercise is that a lot of people ask me, well, how long do I hold this position for? It's not so much of a hold as with the pelvic tilt exercise, it's more of an activation. So if you're really interested in a specific number, I'd say hold about a second or two. But it's more about performing that pelvic tilt, lifting off and getting a good squeeze and coming back down. So no more than that 2-second hold. Now, for those of you with low back pain and significant low back pain, this exercise might be a little too aggressive. So I'm going to come on up and show you a different exercise for this that will achieve that same gluteal activation, but a little less aggressive. Again, you don't want to cave into that anterior pelvic tilt, so doing this upcoming exercise that I'm going to show you will avoid that potential compensation. So we're going to come on off the table. For those of you at home, you're doing the exercises. You can do them on a flat surface, laying down, or you can do this next exercise standing up. So this next exercise I'm going to show you is called a glute set. And we do this in order to achieve that same glute maximus strengthening without the aggressive lift off from the table. So what I tell a lot of my patients, especially when they're having trouble activating this glute area, is to imagine having a pencil in between that buttock area and squeezing that pencil as hard as possible. It's a little ridiculous, but that imagery typically does help. So I'll give you an idea of how it works. So you put your hand right along here and you squeeze that glute muscle and you hold it for about 5 seconds. So we do this once again like the pelvic tilt. We do it for 20 times, but each time you're holding it for 5 seconds. This is achieving more of a stabilization technique as opposed to the constant repetition known with the bridging exercise. So again, 20 times, hold for 5 seconds each time. And now, last but not least, we're going to go into a nice light abdominal activation exercise. So like we said at the start of the video, we do want to achieve a lot of stabilization in the core and a lot of stabilization in that buttock area. With the core, a lot of people think, I have to get a six-pack, I have to be stabilized, but that's not exactly what we're trying to achieve here. So there's 4 layers to the abdominal muscle. There's your rectus abdominis, which is the six-pack muscle. Then there's your external and internal obliques along the side. And then there's that very key, important deep layer muscle called your transversus abdominis. So many people don't really know about the transversus abdominis, but it's huge and it's a key factor in achieving that stabilization of the lower spine. So we're going to activate that muscle today with some light, low-level abdominal exercises. And I'll show you ways to modify it to make it a little bit easier and ways to make it a little bit more challenging. So let's get started. I'm going to be using my handy-dandy 4-pound medicine ball today. Anyone at home is welcome to use a light water bottle if they want to use a lighter weight, or they're welcome to do this without weight in general, or they can use heavier weights if interested. But again, be careful not to push yourself and make sure that you're not doing anything that will hurt yourself. So we'll hop on the table or a nice steady surface at home, and we will go once again on our back. We will keep those knees bent for this first set. We're going to lift our handy-dandy weight overhead, and what we're going to do is basically bring it out past beyond us and bring it forward. Now, one thing to note when you're doing this exercise, you want to maintain a nice pelvic tilt. Again, you want to keep that back nice and flat and protected, and a light activation of that transversus abdominis muscle. So maintaining a pelvic tilt, we lift up overhead, we bring it over, and bring it close to our knees without actually hitting our knees. Up and over. And you should feel a light activation of the core when you're doing this exercise. Now, how many times should we do this exercise? You guessed it, 2 sets of 10 for a 20 total. So how do we make this exercise a little bit easier? We can get rid of the ball, especially for those who are having pain with the weight. And we can actually keep the knees bent once again, keep that pelvic tilt once again. And what we're going to do is alternate the arms. So we alternate here and alternate here. And again, for that 2 sets of 10, just in case the weight is too much. And for those of you at home who are saying, this is a little too easy for me, I don't really feel a lot of core activation, I don't really feel any pain with it, you can bump it up a notch by doing the following. We're going to use that weight one more time. We're going to lift overhead. We're going to bring our legs to a 90-90, meaning you want a 90-degree angle at the hip and a 90-degree angle at the knee. Again, this helps us to achieve that flattened spine and maintain that posterior pelvic tilt. We lift the ball overhead, and we do alternating taps with our feet. And you'll feel a much higher abdominal activation with this one, but again, it's still low enough where we're achieving transversus abdominis activation. And you'll do this for 2 sets of 10. So that's a little way to make it a little bit harder. But again, you want to avoid any exercises that are not for you. And if all of these exercises are not helping or you're having any issues, please feel free to reach out to us at ProClinix. We're happy to do an evaluation for you or follow up with your MD to see what's the best plan of care for you. But we hope that some of these exercises help you out and help you get started with your recovery. Please stay tuned for the next web series, and we thank you for being with us today. And we encourage that you ask a bunch of questions. We're more than happy to answer and get back to you. Thank you so much. See you soon.